welcome to Prepare to Care. We are the AARP podcast that provides resources and tools to help support caregivers and their families. Good afternoon. I'm your host, Eddie Orum. Are you constantly worried about COVID-19? Are you finding yourself feeling more anxious or angry or frightened and sad? If you do, you're not alone. After crisis, as we stretch on with our crisis, and we have prolonged isolation, financial insecurity, and fears about the coronavirus may harm your mental health. Some people are feeling the strain in the forms of depression, anxiety, insomnia. This is becoming a concern for most of us who are at home, dealing with COVID issues. How do you handle these feelings, emotions, and any specific mental health challenges during this very stressful time? Mr. Hansch is going to be someone who's going to assist us today. Greg Hansch is the Executive Director of the National Alliance on Mental Illness of Texas, also known as NAMI. Greg, thank you for being with us. Let's begin with a look at mental health. When we say mental health, what are we talking about? Are there different types of mental health conditions?
Yeah. Well, first of all, thank you very much for having me. I appreciate this opportunity to visit with you on this very important issue of mental health, which is having an impact across society, affecting all of us in some way. I'm glad you asked the question about sort of what is mental health and are there different types of mental health conditions. There are different types of mental health conditions, and I think it's important for us to have a baseline established for this conversation around what is mental health and what does it look like. So a mental health condition is something that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact day-to-day living and may also affect a person's ability to relate to others. They can also have an impact on how we handle stress, how we relate to others, and how we make choices. Mental health is important at every stage of life, all the way from childhood to adolescence and through adulthood and later life. The first thing that people need to know is that they're not alone as they go about dealing with any mental health challenge that may come up. Mental health conditions are very common, in fact, a lot more common than one might assume. And people don't realize this because they're often afraid to talk about what the impact of mental health looks like in their lives. 1 in 5 US adults experience a mental health condition in any given year, and 1 in 25 experience a serious mental health condition in any given year. The major types of it include major depressive episodes, which cause severe impairments that interfere or limit with a person's ability to carry out major life activities. This affects about 7% of adults. There's schizophrenia, which interferes with a person's ability to think clearly, manage emotions, make decisions, and relate to others. This affects a little less than 1% of adults. There's bipolar disorder, which is a mood disorder causing dramatic shifts in a person's mood, energy, and ability to think clearly. This affects just less than 3% of adults in any given year. There are anxiety disorders, which are the most common mental health conditions. This anxiety disorder means intense fear and distress, becoming overwhelmed, causing people to become overwhelmed and prevent us from doing everyday activities. This affects almost 20% of adults. There's post-traumatic stress disorder caused by traumatic events, affecting almost 4% of adults. Obsessive compulsive disorder, meaning repetitive or unwanted or intrusive thoughts and irrational or excessive urges to do certain actions, affecting over 1% of people. And there's borderline personality disorder, characterized by difficulties regulating emotions, affecting over 1% of adults. These are the major types of mental health conditions. There are many others, and they can have a profound impact on a person's quality of life.
Greg, thank you. Very helpful information for us. I I mentioned earlier the COVID crisis that we're currently going through. What can you tell us about COVID and how that might create some anxiety or depression that might affect our mental health?
Well, COVID itself can, as you mentioned, cause mental health conditions or exacerbate mental health conditions. There is the anxiety about contracting COVID-19. There is the fear and around economic uncertainty. Someone may have lost their job and they're worried about their ability to pay their bills. That can cause anxiety to sort of spiral out of control. There's the trauma and grief that people have over losing loved ones or having a loved one get sick. And then there's the big factor of isolation and loneliness, which was an epidemic in our society to begin with. Before COVID came around, people were extremely lonely. Over 20% of adults would say that loneliness was a major impediment to their wellness, and that can cause a range of different health issues. It can put a person at greater risk for heart disease and stress and anxiety and depression. So COVID can, obviously because of the stay-at-home orders, people are not having the same ability to connect with others in their lives, stay connected to the social fabric of their lives. And so that, COVID causing loneliness can lead to a range of other health conditions. Outside of COVID, mental health conditions can be caused by genetics, can be caused by adverse childhood experiences. It can be caused by other chronic medical conditions like having cancer, having cardiovascular disease, can lead to a mental health condition. Mental health conditions can be caused by use of alcohol or other recreational drugs. So, it's a complex range of factors that can lead to a person experiencing a mental health condition, both in the context of COVID, but also beyond the specific context of COVID.
Thank you, Greg. I realize that this is a complicated situation, but what can you tell us about the feelings we might be feeling, or when do we know when we might need to reach out to someone like you or your group, and when should we be concerned about our mental health? Or how do we know if we are experiencing issues that we need to take control of and ask for help?
So there are a number of different warning signs, red flags that can be looked for that may be an indicator that we need to sort of look into our mental health and do something about our mental health. I would say if you're feeling isolated, if you're feeling sad, if you're feeling overwhelmed, that can be a sign that, you may want to talk to someone. You may want to seek out support. If you're feeling worried, excessively worried, if you're having trouble sleeping, if your, diet is interrupted, there are some physical health indicators that can be a sign that something is happening beneath the surface. Those are the sort of things to be on the lookout for, both within ourselves and among the people in our lives, our friends and family. When we see those kind of things going on, that is a bell ringing that, maybe let's go ahead and do something to make sure that there isn't something more serious happening beneath the surface.
Would it be okay to reach out to my general practitioner, or who should I make my first phone call to if I'm sensing and feeling the feelings that you just described? Who should I call first? Or how do I reach out?
General practitioner is a good option if you have a good relationship with a primary care provider. They may be able to provide direct assistance or point you in the right direction to a specialist. You can reach out to organizations like mine, NAMI Texas, and we have the ability to point people towards the resources that they may need. We have a broad understanding of what the resources are that exist to support the mental health of Texans. You can look within your insurance network, and I think that's an increasingly viable tool that insurance networks are facilitating access to telehealth services. We recommend that as a really good option because a lot of in-person services are not available right now, but mental health services, many of them can be delivered effectively through telehealth, and an insurance network is sort of a good place to start for tapping into those resources.
Thank you, Greg. And we do have the NAMI number printed on our screen. And let me say to our audience that NAMI is the National Alliance on Mental Illness of Texas. So we appreciate you guys being there. And Greg, in our situation, we tend to have a lot of caregivers who tune into this. And the caregivers tend to be looking and caring for an elder or child or a relative. We have a sense of what's going on with our care receiver. What should a caregiver look out for to make sure that he or she is keeping themselves healthy mentally?
Mm-hmm. Yeah, that's a really important question. We have a lot of caregivers in our network as well. NAMI was founded by family members of adult children experiencing serious mental health conditions, and over a long period of time, we've proactively strategized around how we can best support caregivers who are, maybe starting to experience their own challenges and are overwhelmed by their family situation, and may start to suffer from caregiver fatigue or secondary traumas. As far as what can caregivers sort of do to take care of themselves, I would say it's really important for caregivers to think about how they can sort of build up resilience before the situation spirals out of control. And what do I mean by resilience? I mean the ability to adapt well in the face of adversity or in the face of trauma or tragedy. When a loved one starts to really have a hard time, we need, as caregivers, we need the ability to support ourselves so we can support them, and that involves building up our resiliency. And I recently heard the term lifequake. Lifequake are the things that happen, that are unforeseen and that totally shake up our lives. We need to prepare for those things before they catch us off guard. So we can, in the interest of building resiliency, we can prioritize relationships, make sure that we are connecting with others who have an understanding of the challenges that we're going through with our loved ones, people who are compassionate, who can validate our feelings. That is an incredible way of building up our resilience. Another way is simply taking care of our bodies. By taking care of our bodies, we have a naturally positive effect on our mental wellness. So exercise, sleep, yoga, those are tools that, can keep us healthy, both in body and in mind. I think those are, some of the most critical strategies that caregivers can pursue to take care of themselves and thereby take care of their loved ones at the same time.
And I want to say to our listeners as well, to continue with what Greg is letting us know, the Prepare to Care handbook that we offer at AARP gives us 5 steps of being a good caregiver. The very last step is to make sure that we take care of ourselves. So, and as a caregiver, I've actually experienced the need of kind of taking a break, making sure that I was healthy, making sure that I understood the process of being a caregiver in the sense of, in my case, we're talking about cognitive impairment. So I needed to look at the stages so I could understand what's happening. And I had to understand that there's some things that I could not change through the process of what my care receiver was going through. So I had to learn how to change how I reacted and change how I behaved and actually begin to talk with other friends who were going through the same thing. Greg, we work a lot with 50 plus individuals. And many of us in this age category have gone through several generations of thinking that we really can't reach out, should not reach out. If we believe we have some anxiety or some depression, that might mean we're not okay. And there's some shame in admitting that we're not okay. What can you say to the generation of folk who aren't quite comfortable in saying, I need some help?
Yeah, I would say that there is no shame. That I would say that it's okay to be not okay. A mental health condition can really impact our quality of life if we don't take the necessary action to address it. The brain is part of the body, and just the same as you would go seek out and talk to a healthcare professional if you're having an issue with your heart, an issue with your stomach, whatever other body part you would go talk to a healthcare professional about. If you're having brain health issues, you should go talk to someone. There's no shame in that. And we need to erase this pervasive stigma that gets in the way of people seeking out the care that they need. It's just part of life. And we need to stop thinking of it as something that's separate from the rest of the body, because it's not. So if a person is experiencing mental distress in any form, whether it's mild, moderate, or serious, I think the first thing, as I mentioned, is to not wait to deal with it. Take care of it right away. These are things that can hit hard and hit fast, and we're better off nipping it in the bud before it spirals into something that can be profoundly disruptive and disabling. You may want to talk to someone who has had a similar experience. The odds are, over the course of your life, you know someone or you even love someone who has also experienced a mental health condition or experienced symptoms of mental health condition. So reach out to them, ask them what worked for them, and that may help you figure out what will work for you. You can also do a free online depression screening through Mental Health America. That's a great tool just to get some direction and get some guidance around what you may be experiencing, and that can point you towards maybe seeking out some assistance from a professional. I also really recommend getting a checkup from the neck up, as they say. Just like we go and get our annual physical, we want to also be making sure that we're consulting professionals who can assess our mental health. Getting that mental wellness checkup is just as important as getting a physical. Those are some pieces of advice that I would give.
Thank you, Greg. I really appreciate it's okay to not be okay. And I think that we can all believe that we can be happier and feel better and should always feel okay to take those steps to do so. Before we leave, is there anything or one last tip you'd like to give to us, or something that we've missed that you'd like for our audience to know?
I'd just like to encourage the audience to check out the resources that are available at namitexas.org. During COVID-19, we have adapted to the situation by making a lot of our services available online. We have free online support groups, both for families and caregivers, as well as for individuals with mental health conditions. We have free online mental health education classes for families and caregivers, as well as individuals with mental health conditions. Those services come at no cost. They're available almost every day of the week. So we want to make sure that people know that we are here as a resource for them, and that they can reach out to us anytime, and we'll help point them in the right direction of mental health resources and support.
Great. Greg Hansch from NAMI, thank you for giving us your advice and your words of wisdom and telling us about your organization. Thank you. Have a great day and be well.
Thanks for having me.
And to our audience, perfectly having you here. Thank you. We encourage our audience to follow the Prepare to Care podcast on iTunes, SoundCloud, or at www.aarp.org/HoustonPC. Again, that's www.aarp.org/HoustonPTC. I'd like to say to each of you, thank you for listening. And as always, thank you for continuing to care about others. Have a great day.